So, welcome to today's Night's Watch discussion. The film this afternoon will be The Lighthouse. So, who wants to start? Perspective, observations? That was not a concrete question where there's a yes or no answer.
It was really interesting. I feel like I don't know, in my opinion, when we start like seeing things, I felt like it was kind of like the what was the movie we watched, the Thing, like when like the dog scene. I was thinking like the same thing about that one, like maybe something like in the lighthouse, like something like just like giving them like hallucinations and stuff, making them see things, and like they're like going through it while it might not actually be happening to other people, you know.
Yeah, I was looking up stuff about lighthouses after that and people who work there, and so people would get mercury poisoning from the lights, right? Because they would just like spin around easier. They put it in mercury, right? So maybe there was a little bit of that happening because he was kind of obsessed with that light.
There's also like the concept of cabin fever, and I thought that the movie highlighted that.
Yeah.
Like,
Alcohol use.
Shared delusion, maybe.
If there are two people there.
Yeah.
Yeah. All right. Well, lot to tease out from the initial observations for sure. First and foremost, I heard that we observed hallucinations. Okay, so perceptual disturbances, hallucinations. By the way, for purposes of shelf examination, can somebody tell me the difference between hallucination and an illusion?
An illusion is like a misconception of a reality, like a stimulus that is there, but you're perceiving it differently, and then a hallucination is not grounded in reality.
And not cued, right, by the environment in any way, right? Yep. That comes up on tests, so that's exactly correct. Good. So apparently new onset hallucinations, there does seem to be some predisposing elements. What might be some biopsycho and social predisposers to these new onset hallucinations? Alcohol, right?
Alcohol withdrawal / alcohol like as an inducer, both.
Yeah, no, I agree. Yeah. And maybe
versus-
withdrawal from could be more of a precipitant. And these aren't perfect. There certainly be some overlap, right? Yeah. Things that induce can also precipitate. Things that predispose can also precipitate. But there does appear to be alcohol use disorder established in the primary character, the lead character, and to that extent might be predisposing to everything we see regarding hallucinations. And then the proverbial cabin fever could also be the precipitant, right? So not only does the Lighthouse allow for a discussion of what will be a differential diagnosis of psychosis, to the extent that hallucinations hallmark psychosis, but in the same context, also about what precipitates and even predisposes to the psychosis. We quickly have a couple of things that we've identified. There's several more.
Both the older man and the younger man ended up killing someone, both of them. So I'm sure that's predisposing them to psychosis.
Again, assuming there are two separate characters here, that might be a predisposing element in that there was a prior. And then what the death that we observe can be conceptualized the way it's going to be conceptualized. But you could go down either path here, right? So if there's only a single character and we see a split, we're seeing his thoughts. That death occurred previous to they're getting to the island, and therefore probably predisposes, whether it's guilt or whatever it might be, a psychological predisposing element.
So for like Winslow, for Thomas Howard, I think he has all the 4 criteria for PTSD. He's the flashbacks and nightmares with that blend with the mermaid monstrous imagery can be like intrusions. He has avoidance, doesn't want to talk about his real name unless it's disinhibited by alcohol. He has self-blame, guilt, negative mood, and hyperarousal. So when he was killing the bird, it felt like very out of being irritated and hyperaroused. And so we talked about this, I think, before, but hallucinations can, in PTSD patients, intrusive thoughts where flashbacks can manifest as hallucinations.
Yeah, I mean, if we're gonna analyze this film from the context of a case study in psychosis, there are several things that the American Psychiatric Association requires us to investigate and rule out. PTSD is not one of them. But however, after that step, the next step would be to see if everything that we've observed is then therefore explained by schizophrenia plus the 5. And if the answer is no, example could be nightmares and flashbacks, then what else? And that's how you develop a differential diagnosis. You just heard this yesterday, but it's worth restating again. That's the progression through case formulation. All right, so keep it tight with regard to what the APA requires, and then you go beyond the requirement. And that's where post-traumatic stress disorder, the discussion of PTSD would fit. Make sense? All right, so if it makes so much sense, you're going to tell me now what are the 5 conditions you have to investigate per the APA and rule out when you consider a primary psychotic disorder such as schizophrenia.
Delirium.
So an underlying medical condition.
Medical condition.
Substances?
And substances. Neurocognitive. I don't know if that's a criteria.
Is it negative behaviors? Negative symptoms?
Definitely a criteria 4, but after you fulfill the criteria, 2 of the 5,
No,
then you have to rule out 5, and we've got 2 of those.
Is it to rule out schizophrenia? Well, I guess brief psychotic disorder? I don't know. Or all of it.
Autism spectrum disorder?
Oh. So we said medical, substance, what was the other one? What was it?
Autism spectrum.
And medical is 1.
Schizoaffective disorder and a primary mood disorder. After you watch a film, after you take your notes, you have to do a psychiatric assessment of a real patient encounter. Then you look at your notes and you decide whether or not everything that you've written down, everything you've heard from your patient, real or fictional, is explained by any of those 6. And if the answer is yes, you've gotten a nice differential down already. However, if the answer is no, for instance, there are nightmares and flashbacks evident in this movie that are not explained by any of or schizophrenia or any of the 5 conditions that we just listed, then you have to think through a differential beyond what the APA requires. And that's how we get to PTSD. So again, the one clinician will look at this and say, wow, given what I've observed, I'm thinking PTSD. The other clinician starts with the hallucinations and then gets into schizophrenia, gets into the APA's requirement in terms of ruling in schizophrenia, and then gets into that final step of, is there anything else that I should consider beyond what the APA requires? So as to explain all the symptoms that I've seen, for instance, nightmares and flashbacks. So, and if you process information the second way, you'll do your patient a significant service with regard to showing your work, thinking out loud, and still getting at that final product, right? Much better to show your work. There is an element of this in terms of the 5 things the APA does require that I heard before in the initial phase of our discussion that I think we need to revisit in terms of that differential. So alcohol, definitely. What other drugs might be playing a role here, or toxins? Amphetamines? We're just seeing amphetamines. I mean, in the movie, or generally speaking?
Oh, sorry, generally.
Generally speaking, yes. Let's take a step back. Thank you for that. What are the 5 substances listed in the DSM that can induce psychosis? Amphetamines/stimulants, alcohol, cannabis.
Opioids?
Opioids, no.
Hallucinogens.
Hallucinogens?
Inhalants.
Good. And then, in addition to that, we get toxins, and I heard that there might be some consideration or concern of toxin exposure in the Lighthouse, right? So what did we say?
Yeah.
Right? Mercury?
Mercury, yeah.
All right. Now, is there anything, listen, if I hear a word come out of your mouth right now that is correct, and by the way, in a similar fashion that I can't make you repeat the year, that would be illegal and unethical, I can't do this either.
Okay.
But hypothetically, if you give me the right answer, go home, honors for your 4-week clerkship
I'm ready.
rotation, right? Ready? Again, full disclosure, I'm not really doing this, right? Everybody's, I don't want to get written up for this. All right, what else is in this movie? And the hint is, actually, no hints first. We'll do this raw. What else is in this movie to suggest that mercury poisoning actually might be what's going on here after all?
Whale oil?
You might be right, but I don't know. Is that true?
I don't know why I feel like there's a link.
Wait, wasn't
The oil was a thing.
I didn't even realize it was from the whale.
There might be a thing. Might be. I mean, we know that fish.
An element
mammals.
that is present in oil and gas deposits.
All right, so you get honors. Yeah, so
Yeah.
that's it. No? So the other hint is that it was already mentioned. You mentioned it already.
Oh. The light.
Well, that too, but there's some other, I think, symbolic element here.
Oh,
So what is the triad for mercury poisoning? Psychosis is one. What are the other two parts of that triad? I don't know if this is going to be on a shelf exam. It could be.
Like tremors.
It's more neuropathy than tremors, right? Significant neuropathy, psychosis, and the third is aphonia or hoarseness. Okay? Give me the character that fits that perfectly.
Oh, the older one.
No, not any movie.
Oh.
Oh, any movie.
Literally presents, central to the theme of the movie is loss of voice, difficulty walking, ataxia due to severe neuropathy, and psychosis. Disney.
Oh.
Anything.
The Little Mermaid?
Yeah. Well, unless you think that Atlantis is real.
Yeah.
Right?
Wait a minute.
In the original by Hans Christian Andersen, it's described as severe neuropathy. Stabbing knives in the bottom of her feet, difficulty walking. Hoarseness, aphonia.
Yeah.
All right. So I don't know if Eggers actually puts that mermaid in there to tip the cap to Ariel and the likelihood of mercury poisoning. But there's a link there. No honors for anybody. Well. All right. What else did you say? What else do you want to talk about? So I heard in the differential the idea of time course. This will come up on a shelf exam. Somebody presenting like schizophrenia, but there's a differential here when it comes to time course, including.
Psychotic disorder, schizophrenia.
Yeah. Give me the time frames.
Less than 1 month, 1 to 6 months. Sorry.
Yeah. Everybody's got that? 1 day to 1 month, 1 month to 6 months, greater than 6 months, right? And what is really interesting here is that this, along with another film to be announced, conform really well to those other psychotic disorders. Remember the name of the chapter is Schizophrenia and Other Psychotic Disorders, and now we're going to look at those other psychotic disorders according to time frame. So the first is brief psychotic disorder. Somebody presents with brief psychotic disorder, right? Somebody presents on the shelf exam, psychotic, with those symptoms being anywhere between 1 and 30 days. How do you choose choice A, or most likely diagnosis? Choice A, brief psychotic disorder. Choice D, schizophrenia. So how do you differentiate this from schizophrenia that you happen to capture early?
History taken.
So number one would be family history, right? Let's say they're not going to give you, they're not going to spoon feed you. Monozygotic twin does not have schizophrenia. Both parents don't have schizophrenia, so they don't give you any family history whatsoever from the person or from information gained from the person sitting in front of you.
So it has to be information from that person. You can't
Well-
collateral.
No. And I'm assuming that the person's a reliable informant here, historian.
I feel like they have lifelong examples sometimes of periods of like disruption to school or ability to care for self. There's other examples that they can provide.
So prodrome, especially one that gets misdiagnosed, right? Misdiagnosed. And I was going to get to that. That prodrome, often misdiagnosed as depression, in retrospect are the negative symptoms, and there's your answer. Brief psychotic disorder does not have negative symptoms. It's double negative? does not have, in the absence of negative symptoms. If you see the evidence of negative symptoms, sure, might it be shared psychotic, textbook-wise? However, the prognosis is guarded, meaning that you are likely to see progression beyond 1 month and even beyond 6 months, right? So just pay attention to that on your shelf vignette. How long is this stint as a wiki for Thomas?
At least 4 weeks. In the beginning, they said 4 weeks.
Yeah. So I love the opening dialogue being very conforming to the DSM in terms of 1 day to 30 days, right? 4 weeks. It fits perfectly. What's even cooler is what I'm about to say. When you watch this movie, did it remind you of anything? Remind you of anything?
Like another movie, or
Mhm. And why? Except The Little Mermaid. That's cheating.
It reminded me of a play I read once, but I don't know if that's what you're
You
getting
read
at.
some cool ass plays.
It's called Waiting for Godot. Has
I
anyone
actually
ever?
heard it, yeah.
It's like, actually, I almost feel like Robert Eggers must have been inspired by it, because Waiting for Godot is this play by this guy Samuel Beckett, and it's these two men, and they're in the middle of nowhere. The whole play just takes place in no man's land. And the whole thing is just them talking about nothing and talking about how they're waiting for Godot to arrive. But you don't know who Godot is. You never find out if they're a person, a thing, and a concept. You never know. And like the spoiler alert.
No. That's it. That's wonderful.
Okay, so you never
Thank
find
you.
out.
Yeah.
And I feel like this is very similar in a way. It's two men on an isolated island in the middle of nowhere having like meaningless almost kind of daily monotony.
Mhm.
Well, this movie, I don't know if this is the answer, but that you were looking for, but it reminds me of Shutter Island, because there's an island, there's a lighthouse, the last scene.
Psychosis.
Psychosis, yeah.
Mhm.
For me, it reminded me of like Telltale Heart.
Hmm.
Edgar Allan Poe. Yeah, like when he couldn't hear the heart under the floor. Like he's kind of like he killed the guy. Or, yeah, he killed the guy, and then he started like hearing things and like under the floor and stuff like that. That's what it kind of reminded me of.
Psychosis emanating from guilt,
From guilt,
guilt
yeah.
due to a murder. You got that one?
Yeah.
Mhm. So, describing this movie, intaker or innkeeper motif, put in a situation of significant isolation, beginning to experience psychotic symptoms. There is the use of alcohol. There is the mythical character that turns into something evil upon embracing and becoming intimate. There are references to Greek mythology. What are the movies that describe? I mean, there's even a scene here where Willem Dafoe's character tells Winslow, "You're outside now, dying knee deep in frostbite," or something along those lines, which is another allusion to the same movie. Nobody's here seen The Shining?
No.
Yeah.
I don't like scary movies.
Yeah.
I'm scared at baseline.
Yeah. Multiple references to The Shining in this movie. I think I just rattled off half of them. There's probably another half dozen. All that said, the Torrances move into the Overlook for a 6-month stint. So if this movie in its time frame, 1 day to 1 month, is consistent with what we would define as brief psychotic disorder, The Shining will then pivot to the secondary condition or the next thing to consider with regard to time frames, and that is schizophreniform disorder. And then anything beyond 6 months we'll call schizophrenia. Other observations, the Lighthouse.
The old character, Wake, he displays traits of paranoid personality disorder, he holds grudges, pattern of distrust and suspicion. For him, it also makes me think neurocognitive decline when I see his character contributing to his personality and symptoms. And then obviously, substance use, he has very high tolerance, so severe substance alcohol use disorder.
Mm-hmm. Yeah, alcohol, no doubt. I do like the idea of paranoid personality, not only because the symptoms fit, but it allows us to further, I think, discuss predisposing elements. So the cluster A personality disorders all confer increased risk for developing a future psychotic disorder, including schizophrenia. And the hierarchy is along the lines of, that which confers the highest risk would be schizotypal personality, I believe followed by schizoid, followed by paranoid. Yeah. So that would be a psychological predisposing factor, and then perhaps the precipitant would be the combination of the social precipitating factor of isolation and the biological precipitant of alcohol. So there's a lot in this movie that could fit into a formulation, that 3x3 rubric that we can look at, not only biopsychosocially, but also with regard to predisposing, precipitating, and perpetuating factors.
He also shows cluster B traits.
Multiple personality traits. So we're going to gravitate from A to B, and you feel antisocial or narcissistic, or both?
Narcissistic, but both.
Yeah. So let me ask you, in terms of the countertransference that maybe you've experienced this morning, albeit offline, did this character make you feel the same way?
As what?
As the thought exercise this morning from the psychotherapy appointment.
Oh.
Times he had so many monologues, he just wouldn't stop talking.
I wouldn't say he made me feel the same way. But also,
Yeah. So,
I see how you could make that character, like Robert Pattinson, feel that way, but I don't know if a
Yeah.
viewer would feel that way.
okay, so maybe this is because you didn't fully identify with the other character. Otherwise,
Yeah,
right?
yeah.
That's fair.
I understand, yeah.
Yeah.
I mean, he literally was calling the other guy a dog the entire time and kind of giving him all of the dirty work when he was just sitting in the light all night staring at it. So I don't know. I feel like if I was in that situation, I'd feel that way.
Yeah.
Yeah, and that gets to yet another element. I keep on going back to this, but I've been doing this for now, 30 years. I keep on going back to the allusion to The Shining. So there is something about that light and this wiki trying to reach that light. And I think there's an undertone that he's not supposed to. So there's an element of grandiosity, if not grandiose delusion. And he's going to pay for it. That is usually conveyed to us, oral tradition, as something that is socially or culturally taboo. So the ancient Greeks had a story about this too. Anyone?
Icarus.
Yeah. Who's Icarus's father? I'm gonna mispronounce his name too.
I remember. He made the labyrinth, right?
That was what I was getting at.
Yeah, but
What-
Nicholas?
Right.
Yeah.
Perfect. Right. But more importantly, that's my next question. What's he otherwise known for?
The labyrinth.
The Labyrinth, which appears in what movie? The Shining.
They caught me off guard.
What? If you're ever caught off guard with me, just blurt out The Shining. You're probably.
is that your favorite movie?
I go. It depends on what day. What's today? Thursday. It's an even day. Yeah. Tomorrow it'll be Jaws.
Oh, nice.
That's really funny.
All right. Other observations.
The shift in power dynamic from the beginning to the end, sort of going. I'm sorry, I don't know your name.
Gabe.
What Gabe was talking about, where like he's calling him a dog, which, side note, dogs are better than people, so I don't think that's an insult, but it sounds like it was intended to be one. But then at the end, Winslow is like more than one in power. Like he literally put the leash on what's his name? Thomas?
Mhm.
Thomas's? Yeah. So there was like that shift there.
Mm-hmm.
Going off about that, there was this towards the end, there was this part where he, Winslow, talks to Thomas, and he starts kind of taking the power in the way he was talking, but then he suddenly kneels down and he's like, I'm sorry.
Oh yeah.
So I thought he's shows a lot of splitting and cluster B traits.
Back to cluster B. Mm-hmm. What is splitting?
Things can either be really good or really bad.
Yeah. And
Typically see it in borderline personality stuff.
mhm. Yeah. people have a difficult time appreciating the ambiguity of other people, places, and things.
Black and white thinking, extremist.
Mhm. And that lends to significant mood lability and affective instability. Other observations discussing the Lighthouse on National Lighthouse Day.
There was a part where the younger man, he has to be told that he's asked this question already and it's been weeks. Are they both kind of hallucinating the time frame, or
Assuming there are two people here?
just assuming they're two people?
Yeah, it certainly looks like it, but
I mean, yeah, it's hard to tell how long it's been.
yeah. Yeah, we talk about time frames and relate it back to these diagnoses in the DSM, but the fact of the matter is that during this movie, the time frames are very much blurred, right? Because and that kind of came up with regard to the provisions and how long they've been on the island, which again is consistent with The Shining. Very difficult to understand how long they've been there because of where the main character's mind has been. And that includes where it's been influenced by alcohol, too. Mm-hmm.
Oh yeah, and I had to look this up because they ran out of alcohol, right? And then they used something else that mimicked alcohol, right? What was it?
And then they threw it up after?
Yeah, it
Well,
was like
one of them
the
did.
goo.
The goo, yeah, and then he threw it
And
up.
they added something too. I forget what that
Mhm.
was.
I don't know.
I don't know. Sorry.
One of the things that we really haven't discussed,
Honey and turpentine. That's what it was. They were also drinking turpentine at one point.
yeah, I mean, that's something we do see from our chronically ill patients. When alcohol, things like hand sanitizer, turpentine and other alcohol-containing goods and products. Mhm. One of the things that we could discuss in context of this film that we really haven't, I don't think, identified or discussed in any real detail is a condition of schizoaffective disorder. We've referred to it multiple times. It's very likely to appear in your shelf exam. So a person presents to you with co-occurring mood and psychotic symptoms. All right? The differential is going to include schizoaffective versus a primary mood disorder with psychotic features. So what are you looking for in your case vignette that allow you to choose A versus B?
They're concurrent.
They're both concurrent.
Yeah, like, do you have mood disorders in the absence of psychosis or psychosis in the absence of mood?
Exactly what you have to look for, yeah.
And then psychotic, like hallucinations, delusions are congruent with their mood, or like.
They usually are.
Yeah.
I would emphasize that a little less than the actual.
Yeah, like the a week of psychotic symptoms with the absence of 2 weeks with the absence of mood symptoms.
Yeah. Yeah. I mean, that gets to the question of if you have one without the other. If you have persisting psychotic symptoms without mood, how long does it have to be sustained for you to say that this is a primary psychotic disorder? I mean, if my patient tells me, yeah, breakfast, that was fine. I certainly heard voices, but I wasn't sad anymore. Does that suffice? If the answer is going to be, of course not. It's going to be at least 2 weeks. Final observations?
I just wanted to say, like, this movie was released in 2019. They made it black and white, which kind of contributes to the loneliness, psychological unease that's depicted in the movie.
Completely agree. It's hard to argue against that one. This is it was an intense movie, multiple levels. Final thoughts? Any questions with regard to anything that we covered? How about you guys tell me if we're discussing the chapter of the DSM titled Schizophrenia Spectrum and Other Psychotic Disorders, well, the spectrum can be looked at in two different perspectives. One is time frames and the other one is symptomology. So a spectrum illness would include schizoaffective. That's on the schizophrenia spectrum, and that's obviously symptomology. Time frames, that spectrum includes brief psychotic as well as schizophreniform disorder. So that takes care of the part of the chapter schizophrenia spectrum, but how about the other psychotic disorders? What other psychotic disorders are published in that same chapter? Delusional disorder, good. Of course, substance-induced, that due to a medical condition, so that's obvious. I think there's at least two more. Catatonia is not published there, so that's something to consider. And then finally, the last one would be, it's now a very generalized category of other/unspecified, but formerly was referred to as shared psychotic disorder, which the group has already addressed.
It's a fancier name, but I can't.
All you do?
Yeah.
Yeah, usually on the shelf exam, it'll come up as both. You've got one in parentheses. I don't think you have to know both. But then again, you know what? As I say that, of course, you guys are going to get tested on only one of those names. All right, that concludes our discussion on the Lighthouse. Are the medical students here next week?
Yeah.
You are? Okay, so next week it'll be the Rocky Horror Picture Show.
Nice.
All right. So I have more to say about that in a second. All right, so it's not scary. The word horror is in it. I know I started that.
No, it's the best movie.
We'll stop there.
Yeah.
I thought it was